Hi, my name is Lakshmi. I'm an oncologist here locally in Austin. I will be talking to you today about some concerns and questions that have been asked about stem cell or bone marrow donation process, why we do it and how we do it, and also the side effects and involvement to a donor as well. Acute myeloid leukemia is an aggressive form of a blood cancer that could happen to anybody, children up until older individuals. Many a time a transplant is the only curative process, and this depends on the genetics of the disease itself. A transplant is utilized to cure and put a patient in remission. We use high doses of chemotherapy in order to eradicate the disease and give stem cells or bone marrow cells from a donor, either a sibling who could be a match or an unrelated donor who is a match. On occasion, we also use umbilical cord to use the stem cells to transplant. Other diseases that a transplant is used for include immune deficiency diseases, usually in young children, and rarely some aggressive forms of lymphomas. Bone marrow constitutes the cells that are in the cavity of the bone. It is the blood-making organ for any individual. We collect sample from the donor by a cheek swab, a non-invasive, non-surgical procedure. The DNA sample is collected from the cheek swab cells. They are decoded, put into a computer database. When we are looking for a donor in the database, we type the donor, put their signature into the computer, and matched with the HLA typing of the recipient and the donor. If we identify a donor, we call them in for additional blood work to rule out any communicable diseases. We usually 90% of the time use a simple process similar to a blood donation to collect stem cells. The stem cells are stimulated, made to circulate in the blood. A needle is placed in either arm. Blood is circulated in a machine through columns in a sterile manner, and stem cells alone are collected, frozen, and sent to the person receiving the transplant. You do not lose any blood. You do not lose any of your immune system. Recovery is very quick. It does take a few hours of your time to donate. On occasion, it could be a minor surgical process similar to a wisdom tooth removal. Usually for children, when a bone marrow transplant is required, you are under anesthesia, conscious sedation, and bone marrow is removed with a needle and frozen and sent off to the recipient. A recovery time from this is usually very short. Your bone marrow and your bone completely recover within 4 to 6 weeks. You are at no risk for infections, and there are no long-term side effects to either of the two procedures. Ethnicity does matter in matching. Our DNA depends on which part of the world and country we belong to. South Asians are a minority of the database. It is usually very hard to find a match due to the few number of people who are registered. The database is secure. Your personal information is secured in the database, protected by law, and will not be distributed. The cost of donation and testing is covered by the insurance of the person receiving the transplant. Hope this helps. Thank you.